we'll delve into the world of microbiomes now.
Thanks very much. Okay, so Helen mentioned this morning the Millennium Ecosystem Assessment. There have been half a dozen new versions of that with precious little implementation, unfortunately. I like to go back to this one, much as we saw the surgery versus window paper from 1983. I think there's some value in quoting original papers, even though things get more and more complex, as I say, without much gain in implementation, unfortunately. So those basic services that were described in 2005 by 150 odd international experts had those provisioning services which are straightforward. If we don't have healthy ecosystems, we get no food, water, fuel or shelter, both in our evolutionary environment and in our current environment. We've just displaced the ecosystem services from our urban areas, but it's exactly the same. Cultural services as well. In the regulating services, I think that disease suppression is the one where we're most interested, because we've got that overlap between ecosystem health and human health. And the model that I like to use to explain that to the undergraduates, which as you can see is a lot simpler than some of the other models we've seen this morning, and that's because I'm a very simple person, and the undergraduates are very simple as well, so that's a perfect match. You have an environmental disruption that leads to biodiversity loss, and because your ecosystem is lacking biodiversity, it now is not functioning. You lose ecosystem function, and the ecosystem service that that functionality provides is therefore lost, and in the situations we're interested in, that can lead to human disease outbreaks. So that is basically creating a public health problem. I used the phrase earlier, shitting in your own nest. That was not a term used lightly. It's exactly what's happening, and this morning we've seen a couple of examples of that, diseases that fit this model. So colleagues, leptospirosis, I think both the hantavirus and the hendrovirus, if you're losing the biodiversity of food options for bats, they move into a less biodiverse foraging environment, and they're creating human disease by piddling on things. As do the mesas that are reproducing rapidly and spreading hantavirus when they've lost their natural regulating services of their populations through competition and predation, etc., in a functioning ecosystem. So that biodiversity loss I see as the key link to focus on research-wise between ecosystem health and human health. And the one that I wish to focus on now is a newish and burgeoning area of interest to do with microbiomes, the environmental microbes that we're exposed to, both through our diet and through our environment. Like you were showing us, people moving through green space, are they getting a respiratory dose of those microbes? So from an evolutionary point of view, you've got a normal microbiome. If you're living in the environment as a hunter-gatherer and breathing, eating microbes, those microbial exposures are training your immune system, and that's what we've all evolved to do for a couple of million years. If you suddenly remove those microbes, you get allergies, infections, autoimmune diseases. So acquiring that group of microbes that we've co-evolved with is the normal healthy situation, because they prime the immune system, as I've said, and that makes us refractory to all of those diseases that we now see burgeoning in Western society. Western diseases, autoimmune particularly, and allergies, asthma, etc. So this is what normally happens. If you have a vaginal delivery, the fecal microbiome and the vaginal microbiome is immediately inoculating the baby. The normal breastfed baby is also taking in environmental microbiomes from mum, and the toddler and growing child is then also taking in environmental microbiomes continuously. And a lot of these things have now been removed. So cesarean births, bottle feeding, and living in a concrete jungle removes all of these natural co-evolved microbiome exposures. And we know from lots of studies that kids who have been born by cesarean and are breastfed or bottle fed have a whole range of disease outcomes that are adverse compared to the ones who have had their natural microbial exposure. It's only with recent advances in molecular technology that we've been able to quantify some of the microbial exposures that may be responsible for that. So the microbes aren't the universal solution to anything, but they're the slice of the pie that's hitherto been unstudied due to our inability technically to do so. So that's why it's a burgeoning research field at the moment. If you look at all these horrible diseases that we've had historically, rheumatic fever, TB, hepatitis, measles, with the potential to kill and create long-term disability, valleys at high levels even if they don't kill people, we've got rid of all of those, which is a good thing. You know, so when your kids are dying of cholera, it's not a nice thing. So you want to get rid of all of those things. And if you go from 1950s, post-World War II to the present day, at least in the Western context, most of those have been eliminated. Unfortunately, in parallel with that, because of our hygiene approach, we have eliminated exposure to the healthy commensal microbiomes that prime our immune system as well. And I know associations are dangerous, obviously, but if you look at the increase in multiple sclerosis, Crohn's disease, ulcerative colitis, asthma, all of those autoimmune allergic diseases are doing exactly the opposite. There's a number of reasons for that. I reiterate, it's not all to do with microbes, but the removal of that immune system training is undoubtedly a significant slice of that pie. So, we know, as I've said, about the adverse effects long-term on your health of having those microbes removed, particularly around birth. Cesareans and bottle feeding are not good for you in the long term. What we don't know is whether the ongoing exposure to environmental microbiomes has a significant health impact as well. You can imagine, from first principles that it would, if this is more our evolutionary environment that is training our immune system with re-exposure to antigens continuously, and kids are now doing this instead, it would not be surprising if there was a loss of that immune training, an oversensitivity and maladaptation of the immune response to antigens that are then presented to the person later in life. Evidence for that includes the association between biodiversity exposure and good respiratory health outcomes. Craig will talk about this in a minute, so I will leave that one. But just to look at what the environmental microbiome component of the environment, how that changes, this is basically just a chronosequence of restoration. So in red down this area, we've got a cleared area. So it's a really bad environment, basically, very low biodiversity. At the other end, we've got remnant vegetation, which is high biodiversity, and ages of restoration in between. So the older you get in terms of length of time of restoration, the closer the environmental microbiome gets to the remnant vegetation, which would have been close to the evolutionary environment that we've adapted to. So what this shows is that restoration works. So if you want to expose people to a healthy environmental microbiome to prime their immune system, remnant vegetation and restored vegetation is good. Restoration actually changes the environmental microbiome if that's what you're trying to achieve in terms of either conservation management or human exposure to appropriate immune training. Does that happen in practice? So here's a pilot study. We got 2 people to sit in their hotel rooms before, swabbed skin, nose, did a microbiome analysis, and you can see 2 things. One, that the people were very different, which is no surprise, but when we sent them out into grubbing around in green space and digging up soil and playing with trees, at the end of that day, microbiome completely changed. So not only is it different between people, but regardless of that difference, you can get a very significant shift in microbiome just after 1 day of playing out in the green space. And I imagine riding your bicycle through your green spaces, maybe not quite as dramatic, but it would have that same effect and provide the opportunities both for colonisation with the environmental microbiomes and also alteration in the immune cascades that occur when those antigens are presented to the body's immune system. So what I've tried to show you is that microbiome also fits this model. You stuff up the environment in terms of removing biodiversity exposure by building urban environments like this. You therefore lose that exposure, which is the disease regulation that biodiversity provides. A functioning ecosystem is providing the diversity of microbes, as we saw with the restored versus depleted biodiversity. And those microbes, or the loss of exposure to those microbes, causes human disease. So this is yet another example of screwing up the environment and you get sick as a result. Nature bites back. What do we want to do about that? I made some comments earlier about implementation. What we need is a prescription for urban green space. So if this association holds up, which Craig will show you some evidence that it does in a minute, then you really want to get people back using green space, and in many cases that's not a matter of behaviour change in the people from a public health perspective, because it's often the least able to change their behaviour that are suffering most. So children in slum areas, for example, you can tell them to go and play in the national park until you're blue in the face. It's not really going to change their lot. But if you green their environment so that they're living in it or transiting through it or using it recreationally, you can improve the normal microbiome exposure and decrease the disease burden. So our ability to demonstrate this causal link, to quantify it, would allow us to then, as I hinted at earlier, put a health dollar saving value on it. And to me, that would be the single most powerful advocacy tool we can use for biodiversity conservation. So if you were trying to tell politicians to release dollars to put the forests back, they'll pat you on the head and say, yeah, sure. If you tell them that the voters will be sick unless they do this, they suddenly pay attention. So that's all from me, and I'll hand over to Craig to give you the technical detail upon which some of that argument is based, and then, as our chairman has said, we're happy to answer questions at the panel afterwards.